Hey there, Jules here, the business RMG. I'm super excited to be chatting with Rebecca Hooton from the 519, which is a 2S LGBTQ plus community center here in Toronto. Rebecca is going to be hosting the webinar on gender and sexual diversity in clinical settings. Rebecca, thank you so much for being here.
It's my pleasure. I'm so excited to be in this space.
That's awesome. So tell us a little bit about yourself, Rebecca.
Yeah, so I am a queer settler from Montreal. I've been in Toronto for 12 years at this point, so it's very much my home. I've been working at the 519 for just about 3 years now, and full-time in the education and training department throughout the pandemic has been quite an adventure. But it's been amazing because we've been able to go into all sorts of different organizations across Ontario in a much more fulsome way. So it's been really great to, be able to have these conversations like we will be having about how to make sure that all of the spaces we inhabit are welcoming and affirming for queer and trans people. And so it's not just about work, though of course we will be brought together in a work context, but in all of the places that we are in the world, to sort of plant these seeds and start these conversations has been really wonderful.
That's awesome. Tell us a little bit about the 519 and what the 519 does for the community.
Yeah, so many things. So as you mentioned, we are a community center. So technically we are a City of Toronto agency. That is bound to serve our catchment area, which includes so many queer and trans folks. And so over many decades, we have grown from just serving the immediate community to people arriving from all over Ontario, and we support them in all ages and stages. So we have an early on center. We have programming for seniors. We have programming for newcomers and refugees through all of the different steps of staying here and being here in a fulsome way. We have programs specifically for trans folks, for trans people of color, for trans youth, and all sorts of other things that are going on, advocacy work, this kind of work, many, many, many more. So it's really a space to create community, create support networks, and come together to celebrate our identities as queer and trans folks.
I love it. The reason that it's important for me as a queer massage therapist to have this webinar is that I've noticed that on a lot of social media platforms, that a lot of massage therapists and clinic owners, they want to be inclusive, but they don't necessarily know how to have the tools, whether it's a health history form and can you ask about gender and sex, and how do you ask, and what's the framework behind that, and seeing all of these conversations on social media. And as a member of the community, I found myself, kind of chiming in and sending people to different resources, knowing that I wasn't an expert. And so this is why I'm bringing on the 519 to give this gender and sexual diversity in clinical settings webinar is particularly of import for me as a member of the 2S LGBTQ plus community. Can you tell us a little bit about what the webinar entails?
Absolutely. So we kind of come together, again, like I said, as humans and as people in the workforce. And so it's important to keep both of our pieces in mind, that we are bringing all of ourselves to this space. In the workshop, we'll be talking about the Ontario Human Rights Code, and so how the protected grounds of sex, including pregnancy, gender identity, gender expression, and sexual orientation, all are covered in the code, sort of the identity terms that are in the definitions in those protected grounds, and how that applies to the experiences of people who are within our communities. And a little bit of history of some of the terms and some, ways, tricks and tips of how to support folks. And then we'll also talk about language, the importance of using people's correct pronouns and names, and the idea that language is not just about pronouns when we're looking to support folks. It's also about all sorts of expansive language that we can use to ensure that people feel seen and heard and respected in our spaces. And you know, some other things thrown in there as well, but I don't want to give it all away.
Yeah, of course not. And one of the things that I found particularly important in as a queer person in the massage community is to inform, you know, whether it's a massage therapist or another clinic, that being an ally is year round. It's really awesome to have a pride flag in, you know, in your door, to make an announcement that it's an inclusive space during Pride Month. But really, being an ally means that it's 365 days a year. And I think a lot of clinics and a lot of massage therapists want to know how to do that. And I'm really excited about this workshop because I know that it's going to empower members of my community, and actually both of my communities, right? My community as a massage therapist and my community as a queer person, to kind of meld that together so that we can create safe spaces for the queer and trans people out there. So super excited about this. If you could share one gem with us about this webinar, what would it be?
Great question. I think my favorite sentence is just, it's so short and so simple, is how can I best support you? And this phrase comes time and time again. And in the work that you folks do, you're already creating these spaces where people are so vulnerable, right? People are coming to you with injuries, with needs. And so you're already setting a space that requires intimacy, requires vulnerability. And so there may be situations where people are sharing parts of themselves with you. And you want to ensure that if they are just telling you, great, wonderful, here's a thing that you now know. But they may also be sharing with you because maybe this is one of the reasons they're coming to you. Maybe they've experienced some form of violence, some form of pain, and that's sort of what's landing in their bodies. But we don't want to accidentally conflate the two, right? If someone's being vulnerable with us, we want to listen and make sure that we are lifting up the next steps in the ways that that person is looking for, and not making assumptions either way, right? So that idea of how can I best support you? What can I do for you in this space that will make you feel that we can take this to the next level in a way that feels validating and supportive and you know, wonderful. People, I think, sometimes overthink it. Allyship is not about, you know, taking 100 steps. It's about listening, and it's about letting people lead and following that lead. So
I love that. Thank you so much for that. It as a queer person, it feels so wonderful to hear that this is something that's available, not just not just through the eyes of the 519, but that it's something that it's available and achievable in medical practices and in clinical settings.
Absolutely. And it's so important.
It is absolutely important. So the Gender and Sexual Diversity in Clinical Settings workshop with Rebecca Hooton will be on October 19th. Rebecca, thank you so much for sitting with me. I'm super excited for this workshop, and I'm really looking forward to it. Thanks.
Thank you. See you in October.
Awesome.